We're going to be going over the cardiovascular system. And in this first slide, it's showing the difference between pulmonary and systemic circulation. So essentially, we have the heart, and the heart is going to pump blood to the body. Okay, that's called systemic circulation. And then the blood has to come back to the heart via the vein system and has to go through pulmonary circulation. So the blood has to go through the lungs in order to get oxygenated. And then once it gets oxygenated, then it will return to the heart and then eventually get pumped back to the body. The red that you see denotes oxygenated, so O2 for oxygenated. And these animations, when you see these pictures, what they're trying to tell you is that is oxygen-rich or oxygenated blood, so they color-code it red. So those are things in the artery family. In the blue family, those are veins, and that denotes CO2 rich or carbon dioxide rich blood. So less oxygen, more carbon dioxide. So they denote those as blue. Veins always return to the heart. Okay, veins always sends blood back to the heart, and arteries always sends blood away from the heart. Okay, the heart is protected by the ribs and the sternum. Okay, now it does, so we have this apex. So if you look closely, there is an apex to the heart, and that apex is right there, and that always points down and to the left. Okay, it always points down and to the left. So when you take an x-ray and you see the heart shadow, that's one way you know right versus left is because of the apex of the heart always points down and to the left. Okay, when you see the word apex versus base, okay, so here's the word apex of the heart, and then there's the base. So apex means things that come to a point, and base means things that are flat. Okay, so it does not mean top and bottom. It's when an organ comes to a point. Okay, so for example, in the lungs, the apex is on top because it comes to a point, and the base of the lungs is on the bottom because it's more broad and flat. Okay, so with respect to the heart, the base is on the superior or top aspect of the heart, and the apex points down and to the left. Okay, you also notice that we have a right and left lung. Okay, so this is the left side, this is the right side, and the heart, okay, does displace the lung the left lung a little bit. That's called the cardiac notch. We'll talk more about that later. Okay, but we do have a right and left lung, and that's going to be important for reoxygenating blood. Okay, the heart has 4 layers. Okay, there's 4 layers to the heart, starting on the outsidemost layer, which is the superior most layer. It is the pericardium. Okay, so the pericardium is the first layer that you come to. Okay, I want to show you. There's also a space. Okay, so the pericardial cavity, or the pericardial space, as you can see here, what's found in there is serous fluid. Okay, so serous fluid is found inside of that pericardial cavity. Okay, now as we work our way down, so we're working from superior to inferior, the next layer that you're going to come to is called the epicardium. Okay, the epicardium. Okay, so far we have the pericardium, the outsidemost layer, and then we have the epicardium. So epi means upon or on top of. And then the next layer in is the myocardium. Okay, so that's the muscle layer. So there's the myocardium, or the muscle layer. And then the insidemost layer is the endocardium. All right, so one more time, we have the pericardium, so working top or superficial to deep. It's the pericardium. And then the epicardium, myocardium, and endocardium. Okay, the pericardial fluid, or the serous fluid that is in between the pericardium and the epicardium, is designed to reduce friction. So there is a fluid lubrication, and there's about 5 to 30 milliliters of fluid that is found in that pericardial space, that pericardial cavity. If there's too much fluid, so it's usually around 50 milliliters or more, then you get this condition called cardiac tamponade, which essentially the fluid, there's so much fluid, it's squeezing down on the heart and creating contraction problems, okay, called cardiac tamponade. Okay, this is page 691 in the book, so the very next page. And this is going to get into more of the gross anatomy of the heart, so let's go over that. All right, looking at an anterior view here. Okay, so this anterior view, there's that apex of the heart. So now we are oriented. That apex points down and to the left, so we know this is the left side of the heart, and this is the right side of the heart. Okay, the yellow stuff that you see, that is fat or adipose tissue. We have the coronary blood vessels. Okay, we'll come back to that in a little bit. Notice there's a bunch of tubes. Okay, we've got red tubes and blue tubes, so denoting oxygenated and deoxygenated. Okay, as blood is coming from the body, Okay, blood is going to be traveling to the heart in the vein system from the body to the heart. And the main tube that does that is the inferior vena cava. Now, this word inferior is a directional term, which is a clue. So in the anatomy world, when they give any anatomy part a name, a directional name, or a size, then it's because you have the other one. So if you have an inferior vena cava, then you have a superior vena cava. And blood is flowing down the superior vena cava as it works its way to the heart. Okay, so going back to the lungs, you have a right and left lung. So there's your directional term, right lung. Well, why did they say that? Well, it's because you have a left one. How about heart? Well, you only have one heart, so they just say heart. Okay, so anytime you see a directional term or a size, like, well, let's use muscles, for example. If you have the gluteus maximus, well, there's a size. It's because you have a gluteus medius and then a gluteus minimus. All right, so these are just clues. When they give you directional term, it's because you have the other one. Okay, there's the pulmonary trunk. So pulmonary is the fancy word for lung. So we know that this is going to be some form of blood supply as it relates to the lungs. Okay, so we have the pulmonary trunk. Okay, pulmonary trunk. And then that is going to split into the left and right pulmonary arteries. Okay, the left and right pulmonary arteries. Now, this one is tricky because this is the only place in the body where an artery is going to be blue. An artery is going to be deoxygenated. Okay, now keep in mind, blood is coming from the body to the heart, which means it is mostly CO2 or deoxygenated. And as the blood is traveling into the heart chambers, which we're going to look at that in a minute, eventually it has to be pumped to the lungs. Okay, so you have all this deoxygenated blood that is inside of the heart that's going to get pumped into the pulmonary trunk and then through the left and right pulmonary arteries. And then they're going to go to the lungs. The blood's going to go to the lungs where it will get oxygenated. And then it's going to return to the heart via the pulmonary veins, the left and right pulmonary veins. Now, this is a vein. And yes, this is a unique situation where it's the only place in the body where a vein is saturated with oxygen. So that's why they have it red, denoted as red. Okay, so the left and right pulmonary veins is returning blood to the heart. All right, these outside parts, well, we'll get back to that in a second with the auricles. Okay, so continuing with the tubes. All right, in order for blood to get pumped to the body, the blood is going to come up into the aorta. So this first part of the aorta is called the ascending aorta because it's going up. Okay, the ascending aorta because it is going up. And then you have the aortic arch with 3 branches off of the aortic arch. And then you have the descending part of the aorta. Okay, now that descending part of the aorta actually goes all the way down and eventually becomes the abdominal aorta. Okay, the 3 branches off of the aortic arch in order. Okay, so we're going to start 1, 2, 3. The reason for the order is because of the direction of blood flow. If blood flow is flowing up on the ascending aorta, then the first tube it's going to come to is that why we denote them as 1, 2, and 3. Okay, now these are going to be major blood supply to the head and neck. Okay, so these 3 major arteries are going to be blood supply to the head and neck. Okay, the 3 branches are going to be the brachiocephalic, brachiocephalic. So brachio is the upper part of the arm, and cephalic means the head. So this tube, the name of the tube is letting you know the direction that this blood supply is going. So it's going to eventually supply the arm. So there's your brachio part, and the head. So there's your cephalic. So therefore they call it the brachiocephalic. Okay, the second tube, it is the left common carotid artery. Okay, the left common carotid artery. Okay, so that's in the neck. The carotid artery is what we palpate when you're checking for someone's pulse. Okay, then the third branch off of the aortic arch is the left subclavian artery. Okay, so it's supplying the left subclavian. So sub means underneath. Underneath what? The clavicle. So this lets you know where this tube is going. Left subclavian artery. It's eventually going to be a major blood supply to the entire left arm. Okay, here's a posterior view of the heart. And this gives you an idea of what the right and left pulmonary veins will look like from a posterior view. And then here's what the left and right pulmonary arteries look like on the posterior view. Okay, here's the inferior vena cava. So this is bringing blood from the body to the heart. And the superior vena cava is bringing blood from the upper extremities and the head and neck. And it will all spill and drain into that superior vena cava as it works its way to the heart. Okay, a major blood vessel, the coronary sinus. Okay, now the heart tissue itself is supplied by these coronary arteries, and the arteries, which are the red tubes, deliver oxygen and nutrients to tissue, so in this case myocardial tissue, and then the veins will take up the byproducts and send it back to the lungs so that you can get rid of the CO2. Okay, now looking inside of the heart. So this is a cross-section in the coronal plane. So essentially they cut the heart in half, and we're going to look at some of the anatomy inside the heart. Okay, one thing to do just to visualize is we're going to divide the heart into quadrants. Okay, so here's a chamber, an upper chamber. You have 2 upper chambers, and you have 2 lower chambers. Okay, we're going to get specific on the names, but one thing that I think that it will make this heart anatomy easier is to just divide it into quadrants, knowing we have 2 upper chambers and 2 lower chambers. Okay, starting here, this is the right atrium. Okay, the atria are always on top, and the ventricles are always on the bottom. Okay, so the right atrium, if you have a right atrium, you have to have a left atrium. And if you have a right ventricle, you have to have a left ventricle. Okay, so ventricles are always on the bottom, atria are always on top. Okay, 4 chambers, and we have 4 valves. Okay, 4 chambers and 4 valves. All right, we have 2 valves that separate the atria from the ventricles. All right, we have 2 valves that separate the atria from the ventricles. So collectively, they're called the AV valves. Okay, that's one of their names. Okay, I'm going to give you a lot of different names for these valves. Okay, so collectively, we have the AV valves, and then you can break it down into the right AV valve, which stands for atrioventricular. So AV is atrioventricular. And you have the left AV valve. Okay, so here is the right AV valve, and this is the left AV valve. Okay, another name for the right AV valve is the tricuspid valve. Okay, so another name for the right AV valve is right atrioventricular valve or the tricuspid valve. Okay, the left AV valve, also known as the left atrioventricular valve, has another name called the bicuspid valve, also known as the mitral valve. Okay, so that one has 4 names: left AV valve, left atrioventricular valve, mitral valve, and bicuspid valve. Okay, bi is 2, so you can see the 2 cusps. Okay, so you can see the 2 cusps, so that's why they call it the bicuspid. And on the right side, there's 3 cusps, so they call it the tricuspid. Okay, continuing with the anatomy. These valves have these little stringy things that are connected to what's called a papillary muscle. Okay, a papillary muscle. And those stringy things are called chordae tendineae. Okay, chordae tendineae, or tendinous cords. okay, chordae tendineae, or the tendinous cords. So they connect the valves to the papillary muscle. And the function of the chordae tendineae is when the heart contracts and those papillary muscle contracts, it will open those valves. And then when the heart relaxes, the valves close. All right, so that takes care of 2 of the 4 valves. The other 2 valves are found in the tubes. All right, so they are found in the tubes and they are named after the tubes that they are in. So if there's a valve inside the pulmonary trunk, then they call it the pulmonary valve. Okay, the other name for that is pulmonary semilunar valve. Okay, so the pulmonary valve has 2 names, pulmonary semilunar valve or simply pulmonary valve. Now, semi means partial and lunar means moon. So whatever anatomist a long time ago looked at him and said, oh, it looks like a semi-moon, so we'll call it semilunar. The other semilunar is the aortic valve. All right, so the other semilunar is the aortic valve, also known as the aortic semilunar valve. Okay, now collectively, they are the semilunars. Okay, so you have the AV valves, 2 of those, and you have the semilunars, 2 of those. Okay, now sometimes through lecture and some other anatomy things, I will refer to them as the semilunars. And when you hear that, know that it means aortic and pulmonary valve, because those are the semilunars. And then you have the AV valves, right? So you have 2 of those, atrioventricular valve. Now that's important to be able to understand it that way because of how the valves open and close depending on the rhythm of the heart. Okay, other anatomy parts is we have the interventricular septum. So interventricular septum. So septum means wall. Inter is in between. In between what? The ventricles. So there's your right and left ventricle. Now it is made of myocardial tissue. Okay, the interventricular septum is made of myocardial tissue, which means heart muscle. So there's your myocardium. All right, so I'm going to highlight the myocardium. Okay, so it's essentially all of this, okay, all of that. All right, so the heart is, it is a muscle. It's cardiac tissue. It's cardiac muscle. Okay, so it's just one big pump and one big muscle. All right, you'll notice that this left ventricular chamber, notice the myocardium, how thick it is compared to the right ventricular wall. Okay, the right ventricular wall is thin, and the left ventricular wall is thick. Now, first of all, that's one way that you can identify right versus left is notice the thickness of the left ventricular wall and versus the right ventricular wall. Okay, now the reason for that is because when the left ventricle squeezes, when it contracts, it has to eject blood through the aortic valve into the aorta and into systemic circulation, so to the body. All right, so it has to contract hard enough to send blood to the entire body. That's why the left ventricular wall is thicker than the right side. Now, the right ventricular wall is thin because all it has to do is eject blood to the lungs. And that's not very far away. Okay, so the right ventricle, when it squeezes, it has to eject blood into the pulmonary trunk and eventually the right and left pulmonary arteries, which means it's going to the lungs. Not that far away, so the myocardial wall is thinner. Okay, you'll also notice the apex. So this should help you differentiate the left side versus the right side. Okay, we've got the left thick ventricular wall and we have the apex, so now we know left versus right. Okay, here is a picture of the cusps. So why they call it tricuspid, because you can see the three cusps, and then on the left side, that's also known as bicuspid, because you can see the two cusps. Bi is two. Now it's also known as the mitral valve. Okay, remember the left side that has four different names: left AV valve, left atrioventricular valve, mitral valve, and bicuspid valve. You'll also notice the aortic valve, and and those are the semilunars. And there's the pulmonary semilunar valve. Now, at the moment, they're closed. And then you'll notice that the AV valves are open. Okay, there is an opening in the aortic semilunar valves, and that's so that is when blood is being sent up the ascending aorta, blood will spill into these coronary arteries to actually supply the heart myocardium with nutrition and oxygen. Okay, some real pictures of the semilunars. A real picture of the chordae tendineae and the papillary muscles.